What's up, everybody? My name is Daniel Hearn from Hard Knocks Talks. I'm happy to be here today in partnership with the Office of One Health and Wellness at the University of Saskatchewan to bring education to St. John Ambulance therapy dog teams volunteering in our community and others as well. Before we get started, I would like to acknowledge that I am coming to you from Treaty 6 territory and homeland of the Métis people in Saskatoon, Saskatchewan. Today's speaker, Erin Beckwell, is speaking about Therapy Dog Program's participants' mental health. Let's bring her in. Hey, Erin, how are you?
I'm good. How are you, Dan?
I'm doing well. Why don't you tell us a bit about who you are and why you do the work that you do before we get started?
Sure. Yeah. I live in Saskatoon as well here, and my professional background, I'm a social worker, but I'm also a person who's experienced mental health struggles, trauma, and that really is a big reason why I started doing what I do. But of course, I also work with lots of folks who were struggling in ways that others didn't always understand, including service providers, and decided that part of what I wanted to do in the world was do something about that. And so I came to be doing various bits of teaching around trauma and mental health and other types of topics.
Awesome. Well, the floor is yours. The floor is yours, my friend. Have at it.
All right. Okay. Well, thank you. And so, what I'm going to sort of run through today really covers a wide range of sort of little slices around mental health, stress, and trauma. And so, we're going to talk about how these things actually shape the ways we think, feel, and act, how we relate to other people, which of course then brings it into the realm of the things you may experience as a therapy dog handler, and even just in your own interactions in the world. And I also will talk a little bit about the words we use and how language can, I mean, it has great power, and how we can look at language as a way to show up for folks in maybe better ways, or ways that feel a bit safer. And we'll look at a few strategies that you can use when you're out with your therapy dog team in your community. And so, just a few things to think about as we begin this talk. I'm going to talk about stress, trauma, and intense experiences. That said, I don't talk about specifics in a lot of detail. However, this can bring up intense or uncomfortable feelings, memories of really difficult experiences you've had. So do what you can during this time to, stay calm, grounded, responsive, connected. Maybe you want to just sort of do a quick scan of your body, your brain, and am I stressed right now? Am I feeling comfortable? And just remember, you have choice and control about how you interact with this session. And so if you need to step away from it, do it. That is okay. If you need to sort of digest it in little bits, that's great. But also remember, if this does bring up tough stuff, you have your own internal resources to draw upon, but it's also okay to ask for help and talk to others. And just before I launch into this, I just would like folks to acknowledge the impact of your environment right now. Are you watching this in a coffee shop? Are you watching this in your comfy chair in the living room? Are you in an office? Those things may influence how you're feeling, but also how you cope with stress. And so this is a good teaching just for life in general. Are you in a comfortable space that feels safe to you? You'll be able to handle much more intense experiences, including sort of content, if you're in a space that feels safer. But if you're in a space that doesn't feel great, or you're not feeling comfortable to listen to this talk, those sorts of things, just remind yourself that may impact how you feel as we go through this content. And it's an important factor. So I'm going to start by talking a bit about stress, and then we'll sort of move into talking about trauma. And of course, stress is all around us all the time. And stress is a thing that we all navigate constantly. It could be something that's happening that's one thing. It could be lots of things. It could be about circumstances, maybe not exactly what's happening, but where I am, who's with me, not with me. how I feel in relation to this environment. But we also have other types of stress that are sometimes a bit harder to understand or even to see, things like environmental stress. So it could be that I live in a neighborhood that doesn't feel particularly safe or low stress, and that is a backdrop to everything else you experience in that environment. It could be that broader pieces of our environment, like human suffering, suffering of other species and of our physical environment, is also part of our stress. And for some of us, that is a significant burden of stress that we're carrying all the time. Then we add in historical stress and trauma. And so, of course, in many cases, when we're talking about this, what comes to mind is the experience of Indigenous folks and the impact of colonialism on Indigenous people's language, culture, but also their mobility, their freedom, and just their sense of safety in their communities, in the world in general, but also in their own bodies. And so we have all this happening sometimes at once. And so trauma can feel really intense. It can feel less intense, which is sort of the spectrum in between. So stress in and of itself, or trauma in and of itself, isn't actually what we're going to talk about today. It's the sort of underlying piece that then we need to talk about the response. And that, I think, is the critical question here, is how do we respond to this? And often how we respond to stress is a pattern that's been established for a long time in our lives. And we may not even see it because it is just so almost intuitive to come into these responses to stress. So there's something called eustress, which is actually positive stress. It can help us achieve more, perform better, experience new and exciting things in the world. So stress is not always bad. There's also distress, which of course is negative. Most of us are much more familiar with talking about things that are distressing. But then when we move sort of beyond stress, we can move into this trauma response, which can be about an immediate situation that our body and brain are responding to. It can also be delayed. We may respond long after that stressful or threatening situation has passed. And in fact, that's one of the unique things about trauma, is that there can be delayed responses, sometimes by years, where people are reacting to something that's very much not in the here and now. And then we have what's often called a complex or persistent trauma response, where it starts to sort of spread and creep out into our lives in lots of different ways. And this said, we also know we're all individuals, and we all have unique factors that shape what our responses look like, and what we feel is an accessible response or a safer response for us. And that includes our gender, our culture, how old I am now versus how old I was when something very difficult or stressful or traumatizing may have happened. I may understand things differently now, be able to cope with things differently now. But certainly when we get into more complex, layered, endearing types of trauma stories or stress experiences, that shifts the response as well. And then people's access to things like supportive or affirming witnesses. So people in your life to say, wow, that was brutal. It's amazing that you survived that. That's an affirming witness. Many of us don't have access to something like that. It is so basic, which is actually one of the reasons that therapy dog teams are so important, is that so often dogs can be that affirming witness in a way that humans have maybe not been for people, where dogs maybe don't have the words, but they have the all of the other pieces that tell us that, yeah, what happened to you is difficult and it will be okay. So I think then when we talk about stress and trauma, it's important to think about, eustress, or that positive stress. It's usually short term. It's usually, motivating or exciting. Maybe we're going to start a new job, go on a trip, extend our family in some way. They often say that things like marriage, which can be very happy and exciting, is one of the most stressful things people can experience. And it's a great example of eustress, usually, not always. Distress, though, can be short or long term. It's usually mostly negative or not so great in terms of how it affects us. So it's what brings anxiety, worry, concern, a whole bunch of unpleasant feelings. It often decreases our performance or our ability to engage and cope and relate with others. So this includes all sorts of things like pain, injury, loss, and that can be of a person, of a pet, of a job, of a house, of a sense of safety. There's all sorts of things that we can lose. Also, though, this can be about, again, that distress about the world is hurting. And I think right now in particular, we're still in the midst of a pandemic. There's violence, around the world. We see social injustice, and that can bring a level of distress that becomes this sort of fairly persistent backdrop for folks. And we don't talk about it enough. But also, anytime someone is in a situation where they have less control over their environment. So think about hospitals, schools, correctional settings, even substance use treatment settings can be very distressing, partly because there's so much beyond that person's control in their environment that it sort of elevates that stress response. Then when we move into trauma, we often start talking about different sort of types of trauma. You may have heard people talk about small t trauma and big T trauma. I actually think trauma is trauma. And that may not be what everyone believes about this, but what affects me in a way that results in distress that is so severe it's traumatizing may be different than what impacts Dan or that what impacts you. And so being able to acknowledge that trauma is very subjective, it's very relative. And so trying to create a hierarchy of trauma is often a very futile exercise that doesn't help folks in the end. Because what it can do is sort of minimize experiences that have been very, very harmful. It can also keep people kind of stuck in a place where they feel like they have that big T trauma, which is often when we think about things like, abuse, neglect, significant experiences of violence, displacement. So think about refugees, perhaps. And those absolutely are very impactful. They are not always more impactful or more negative than things that are often seen as less severe examples of trauma. So as I mentioned earlier, though, the signs of trauma can show up immediately as things are happening or right after. They can show up down the road, though. And that's often when we talk about a trauma response, it's a response to things that are not what's happening in the here and now. Our brain and our nervous system are actually responding in a sort of precautionary stance based off of what has happened in the past. And so that can become a bit challenging for folks to work with because they may react to things that aren't happening. And others may not understand. They may not understand that that's why they act that way. And often we see folks have these types of responses, and that may be in their body, their mind, their emotions, their relationships, their spirituality, all of it. And it can and often does impact us in situations far, far removed from that original trauma, if we can even name what it is, all the way across the lifespan. And so that can be really challenging because it results in the sense of feeling unsafe. It could be in very specific situations, but in some cases, that actually sense of unsafety becomes quite generalized, where it may be all interactions with new people feel unsafe. Anytime I leave my familiar routine, I feel unsafe. If I'm in a new environment, I feel unsafe. And so it can be really challenging to try to understand and articulate what that's about because it sometimes isn't even clear to us when we're experiencing what's going on. So this is basically the summary of that trauma comes from any event, series of events, or set of circumstances. It could be all of those that people have experienced. It could be one. And the further we get from a specific event causing a response or a reaction, the more challenging it is for people to understand, for people to support others, for folks to even understand what's happening in their own brains, bodies, and nervous systems. The other piece, of course, that often doesn't get named when we talk about trauma is that there's also historical and intergenerational trauma that is a very real thing that even if folks have not personally directly experienced an event, series of events, or set of circumstances, maybe their life has been pretty good. However, they may be responding as if they've experienced these things. And that's really tricky. Folks often struggle so much when it's like, but I didn't go through anything. Why am I reacting as if I did? And that's one of those interesting, fascinating, complex pieces around how trauma can, in many ways, be transmitted through generations. Until that pattern is disrupted in some way by folks doing healing work or engaging in some recovery around that trauma. Even naming it is a really critical piece of that process. And so we need to remember that trauma is such a broad category. It's a great big pool of experience that occasionally we can understand a little bit, we dip our toe in, but very often it is tough to really understand what that big pool of experience looks like, even when it's our own lived experience. And that in and of itself isn't what trauma is. That's the experience piece, which, what's happening, and then our brain and nervous system does some interpretation of that. And it filters our experience through what we've experienced in the past, how our interactions that are similar have gone, whether we've experienced harm, and all sorts of other little layers that we filter experience through. And this is happening without our conscious thinking about it. Our nervous system just jumps to do it as a means of protecting us. So if we've had trauma in the past, we're more likely to have trauma again, because our nervous system tells our brain, yeah, this has happened before and it didn't go well. So we're going to head it off at the pass and make sure it doesn't happen again. And we're far more likely to start assessing our world as unsafe and reading threat in the world when we've already had that experience, which makes sense, I think, to most of us, right? That we're going to be cautious. But the challenging piece of it is the caution is often not something we're consciously aware of or even in control of. Our brain and nervous system is like, no, we don't even have time for you to think about whether you need to be cautious. We're just going to make you cautious. And then the last piece of it is that adverse effect on our functioning. It could be, we can't get out of bed. We struggle to attend to our basic hygiene. Maybe we're really struggling to parent or be a good partner. And that leads us into those sort of social and relational well-being pieces. Of course, that's a part of everything for humans. We're wired for connection, generally speaking, and trauma really messes with that wiring pretty directly. And so it messes up our ability to show up in relationships in ways that we feel comfortable and safe. It may mean we can't be in relationships much at all. However, when we're going out into the world, we often have to. It may not be deep, lasting, meaningful relationship, but we have to interact with other people, which is, again, where therapy dog teams, I think, can be such a useful piece to help bridge those social and relational gaps and reduce the sense of threat for folks. So it can help really reduce those negative effects in particular situations. The other thing I just want to say about this is, of course, you can see this could impact you negatively in almost any part of life. In some people, it shows up in very specific ways. We often see folks who have physical pain, for example, and when we rule out all of the reasons that pain could be there, and we're left with nothing, often people are told, well, it's all in your head. It's psychosomatic. It's maybe attention seeking, maybe drug seeking. That comes up a fair bit too. And really being able to realize that for many people with trauma, that pain is their body's attempt at signaling something is not okay. It doesn't mean we have illness, injury, some cause that can be measured by our traditional medical model where we do blood tests and scans and surgery. It may look like you were perfectly healthy, but then to be told you're fine. And to have folks head down that road that really does stigmatize people where it's, you're attention seeking, drug seeking, it's all in your head, refer you to psychiatry kind of response doesn't fully reflect an understanding that for many people, if we've ruled out all the logical reasons that these things are happening, whether it's mental health stuff, memory stuff, pain stuff, relational stuff, we should be saying, could that be trauma? We might not ever get the answer to that question, but it's a really important question to ask. So this is sort of my shorthand, and it's not mine, I didn't come up with it, but it's the one I use. In other words, so trauma is an experience that overwhelms our capacity to cope. Too much, too fast, too soon. And so what is too much for me right now might be very different than what's too much for me in 3 hours. When I'm at the end of my day, I'm tired, maybe been sitting too long, I'm going to have a reduced coping capacity because my body's exhausted, my brain's maybe used up pretty much. Maybe I've had some stressful news or a difficult conversation that has further impacted my coping capacity. So what is really important when it comes to stress, trauma, mental health is coping. And that is often the most accessible thing that we can do, is look at how do we cope when things get stressful. And many of us have tried and true methods of coping with stress. We also often all have things we do when we are stressed, that we're maybe not so happy about, that maybe we don't tell other people about, which then contributes to that sense of shame and stigma around those ways of coping. But what is so crucial is to acknowledge the value of those things, even when they have a less positive side. They often have a big upside in terms of helping us cope. So anything that comes at us in a way that overwhelms our coping capacity can trigger that trauma response, which opens it up to almost anything being a potential cause of trauma. And of course, this also holds true generally for stress, especially prolonged or really intense stress. Sometimes people use the language of toxic stress, where people are under stress, especially children who've experienced stress early in childhood. They may be wired for stress and really struggle when things are not stressful. But that doesn't mean they have infinite coping capacity just because stress feels comfortable to them or familiar. There's still a risk that their coping will be overwhelmed. And so we can focus on how we notice others coping, how we notice ourselves coping, and check in and say, how am I feeling today? Is it going to be a day where it doesn't take as much to overwhelm my capacity? And we can be curious about what may be overwhelming the capacity of others in our environment as well. So this is, I think, a really nice connection in with, we're often thinking about our dogs when we're doing this work, right? And what is their capacity? And so taking some of those lessons about how we're attending to, capacity, safety, stress for dogs actually is very transferable to how we interact with the humans, who are often the ones we're going out to support.